I'm Nicole Gehring, and today I'll be discussing why the government should ban cigarettes and tobacco products. Do you know the harmful effects of cigarettes and tobacco products? It's a killer for us. Research reveals on the World Health Organization website, updated July 26, 2019, that tobacco kills more than 8 million people each year. More than 7 million of those deaths are the result of direct tobacco use, while around 1.2 million are the result of non smokers being exposed to secondhand smoke. Who pays? Us, you, me, anyone that uses tobacco products or is around someone while they are using the products. I ask myself all the time, why would someone want to put their lives and others at risk? So I did research on it. Cigarettes and tobacco products kill up to half its users and should be banned completely. You're not just harming yourself, but you're harming your family and friends as well. The negative impact tobacco has on you and others around you is tremendous. Tobacco products are the leading cause of death, illness, and impoverishment. The tobacco epidemic is one of the biggest public health threats the world has ever faced, killing so many people around the world. According to TheGuardian.com, updated July 26, 2019, Nicola Davis states that it is estimated that about 1.1 billion people are currently smokers. 80% of the 1.1 billion smokers worldwide live in low and middle income countries. Robert Proctor states on tobacco control .bmj.com that the cigarette is the deadliest object in the history of human civilization. According to ncbi.gov, Emily Stone and Matthew Peters state the low and middle income countries can have contrastingly high rates of adolescent smoking, particularly among boys, where rates in some countries can reach as high as 46% and reflect high rates of all age smoking. Many of the low and middle income countries suffer from fairly lax tobacco control measures. Smoking bans, if they exist, are not enforced, and adolescents have access to cheap cigarettes. A global tobacco study found that an enormous amount of data from a large number of countries and provides valuable insights into low middle income countries where most of the world's cigarettes are currently smoked. For example, tobacco use contributes to poverty by diverting household spending from basic needs such as food and shelter to tobacco. Tobacco use can have negative consequences for the economic well-being of smokers and their immediate family members. Stated on the ncbi.gov website, Young Do and Mary Ann Bautista say that this impact has been described as the crowding out effect of tobacco use on household consumption. Given a fixed household budget, spending on tobacco may cause or may divert items such as food, education, and healthcare, which are indispensable components of human development, particularly for your young children. The spending behavior is difficult to curb because tobacco is so addictive. You become addicted to nicotine. The younger you are when you begin to smoke, the more likely you are to become addicted to nicotine. Nicotine is a drug that occurs naturally in tobacco and is thought to be as addictive as heroin or cocaine. According to the cancer.org, the American Cancer Society medical and editorial content team states that researchers found that about 18% were able to quit drinking, more than 40% were able to quit opiates or cocaine, but only 8% were able to quit smoking. When we look at the spending behavior, smokers spend a lot of money. For example, a chart that was posted on umassmed.edu, it says that if you buy one pack of cigarettes each day, it would cost on average $5.17 per day, making it $36.24 a week, which comes to $154 a month, $1,887.05 a year, and in 10 years, you would spend $18,870 on cigarettes or tobacco purchases. The economic costs of tobacco use are substantial and include significant healthcare costs for treating diseases caused by tobacco use. On the Centers for Disease Control and Prevention website, it states that smoking-related illnesses in the United States cost more than $300 billion each year, including $170 billion for direct medical care for adults and more than $156 billion in lost productivity, including $5.6 billion in lost productivity due to secondhand smoke exposure. In some countries, children from poor households are employed in tobacco farming to boost family income. Sarah Bosley states on TheGuardian.com that children labor in tobacco is rampant and on the increase in poor countries. Evidence from 3 continents show how children aged 14 and under are kept out of school and employed in hard and sometimes harmful physical labor to produce the tobacco leaf that fills cigarettes sold internationally, including in the UK, US, and mainland Europe. A 14-year-old girl in Malawi stated, "I wanted to be a nurse, but instead, she spends her days weeding under a hot sun with a heavy hoe. Families see no option but to use their children in the fields as unpaid labor. Many are in debt to landowners and landlords and have to stay on from one season to the next, unable to break the cycle of deprivation." It was reported about 1.3 million children a year were working in tobacco fields in 2011. The numbers are rising with a shift in tobacco growing. An investigation done showed in Malawi that children are being taken out of school to weed tobacco fields and harvest the leaves by parents who live in dire poverty. The families live in straw huts and are paid nothing for 10 months until the tobacco crop is sold. In Mexico, children are working in 7 out of the 10 plantations. In Indonesia, a 14-year-old has chest health problems from working in the fields. The U.S. Department of Labor lists 16 countries where children work in tobacco farming. Not only are children affected by tobacco, but so is our environment and our bodies. Cigarette smoking causes environmental pollution by releasing toxic air pollutants into the atmosphere. Cigarette butts also litter the environment, and toxic chemicals in the remains seep into soil and waterways, therefore causing soil and water pollution. Animals and plants that come into contact or absorb the toxic substances from the cigarette residues are affected as well. The industrial processing and smoking of cigarettes adds huge volumes of air pollutants into the atmosphere. Secondhand smoke pollutes the air directly. Most of the ingredients present in the cigarette butts are non-biodegradable and take years to break down. The ingredients in the filter remain in the soil for a long period of time, possibly up to 10 years. Smoking globally emits nearly 2.6 billion kilograms of carbon dioxide and 5.2 billion kilograms of methane into the atmosphere each year. Smoking contributes to climate change. Fish are also impacted by cigarettes in countless ways. Fish will eat the cigarettes, mistaking them for food. A single cigarette butt can kill a fish in a 1 liter jar of water. Your pets are also at high risk for ingesting cigarette butts. The consequences can be damaging and may even kill the pet. Secondhand smoke may also make the pet susceptible to asthma or other lung complications. About 17,000 people worldwide are dying each year because of fires started by cigarettes. The direct risk tobacco has on our bodies include cancer, autoimmune disorders, type 2 diabetes, premature deaths, lung disease, heart attack, stroke, complications for pregnant women, along with the dangers of secondhand smoke. Smoking is one of the leading causes of lung cancer deaths in the world. Smokers are vulnerable to respiratory infections. Smokers' lives are shortened by at least 10 years compared to non-smokers. COPD, emphysema, and chronic bronchitis are caused by smoking also. Those exposed to secondhand smoke are at high risk of suffering from most of these diseases and health complications associated with firsthand smoking. There are solutions to preventing tobacco use. Prevention can take the form of policy-level measures. Tobacco tax increases are one of the most effective ways to reduce smoking and other tobacco use. Raising taxes raise the price of the tobacco products, making people not want to buy because they can't afford to buy it. Stricter laws regulating purchases of tobacco products, how and where they can be purchased, and when and where they can be used, and restrictions on advertising are all ways to decrease and help to get rid of tobacco products. Prevention can also take place at the school or community level. Merely educating potential smokers about the risk will also help. Successful evidence-based interventions aim to reducing or delaying initiation of smoking. We need to educate everyone on the health risk of smoking. As I said already, cancer is the leading risk. Reducing or mitigating modifiable risk factors and bolstering protective factors help for adolescents. Risk factors include having family members or peers who smoke, being in a lower socioeconomic status, living in a neighborhood with a high density of tobacco outlets, not participating in team sports, being exposed to smoking in movies, and being sensation seeking. Do you wonder what it would be like to ban tobacco products now that I've given you details about it? We would have a healthier environment and healthier people. Our air would be cleaner. The soil, beaches, and waterways wouldn't be polluted with cigarette butts, plastic filters, or other remnants of smoked cigarettes. Our pets wouldn't suffer from the secondhand smoke. We wouldn't have as many forest fires killing people, animals, and destroying homes. Everyone would have a healthier body and would live longer. There wouldn't be as much lung cancer, asthma, emphysema, COPD, along with all the other diseases associated with smoking. We wouldn't be breathing in secondhand smoke. Children wouldn't have to work on tobacco farms. If we don't ban tobacco products and cigarettes, we are cutting our lives short and the ones we love. We will keep suffering the consequences of secondhand smoke. Let's do more than imagine banning cigarettes and tobacco products. Let's take the steps to make it happen. Once again, cigarettes kill up to half of its users. That's an impact on families all over the world. If we allow this to continue, it's going to destroy our environment and our families. Can you imagine a child losing a parent over tobacco products or secondhand smoke? You, me, us. We can change the world and make it a healthier place for all of us. We can save lives in our environment by banning all tobacco products. Thank you, and once again, I'm Nicole Gehring.